Hello, this is Dr. Nina Granel. I'm from the nursing department of the Universitat Autònoma de Barcelona in Spain. I'm going to present the following research mapping nursing practices in rehabilitation units in Spain and the United Kingdom. This research was co-authored by Dr. Maria Dolors Bernabeu, Dr. Joan Manuel Leiva Moral and Dr. Mariela Patricia Aguayo Gonzalez from the nursing department of my university. We all belong to the Grievous research group. So, from the literature, we see that there's a lack of information related to the difference in nursing practices between countries across Europe. Spanish nurses emigrate to the UK to find job opportunities before the Brexit. And today there have been no studies published mapping nursing practices. So the aim of this study was to compare the nursing practices in Spain and the United Kingdom in special units, rehabilitation units. So a qualitative research methodology was applied, and in particular a multiple case study. 8 nurses from rehab units of both countries participated in the study, and the inclusion criteria were to include units with similar number of beds and pathologies from both countries. The data collection techniques used were a non-participant observation. 117 hours of non-participant observation were applied in the unit by the main researcher that it was in this case myself, in the interviews to the nurses and document analysis of the documentation used in the units. So in this table, you can see the categories and subcategories found in this research. I'm going to read the subcategories. Those were material and human resources, the procedure for administration of medication, the techniques, the maintenance and supervision of the equipment, the management task, patient personal care, health education, emotional support, the evaluation and decision making, and documentation and interpersonal communication. And those subcategories were classified in 6 main categories. So the first category was resources, understanding the workplace. In this picture, and well, in these maps, you can see how the units were designed. On the left side, you can see the Spanish unit. It was much smaller than the UK unit. The UK unit had bigger rooms, more spaces to storage medication, spaces for the staff to rest and to procedure some techniques or managemental procedures, right? And the UK unit had also more material resources than the Spanish unit. And the most significant difference is that the UK unit had double the number of nursing staff, having similar units according to the numbers of beds, right? So number of patients allocated in those units. The second category was techniques and nursing procedures, different routines. In the UK unit, staff are required to undertake an additional training to demonstrate their competencies to carry out some techniques. For example, you need special training to administer IV medication, to introduce an NG tube for example, the technique of catheterization, male or female. So on the other side, in Spain, it is not needed this extra training to perform this kind of techniques. And the routines of the administration of medication in both units also differ, no? For example, the practice of double checking. In the UK, to administer drugs or some antibiotics or IV medication, it is needed to double check the medication by 2 members of the nursing staff, right? In Spain, otherwise the nurses prepare the medication all at the same time for all the rooms in the unit, and then the medication was administered after the preparation. You can see in the second picture the trays with the with all the medication prepared. In each pot, it's prepared the medication for a different patient. And it's obviously it is marked with a marker the number of the room in the pot, okay, in the plastic pot, and it's thrown away, destroyed after the use. And in the UK, the procedure was different. The nurses prepare all the medication for one patient, administer the medication, and then document these procedures. And afterwards, they close the circle and move to another patient, another room, and start the circle again. Preparation, administration, and documentation of the procedure all in once. The third category was patient's personal care beyond procedures and techniques. In the UK unit, personal care is considered one of the nurse's main tasks. In the Spanish unit, the nurses do not provide personal care to patients, feed them or take them to the toilet, with the exception of the night staff. Healthcare assistants are more involved on this kind of procedures. So this was the main difference, right? Healthcare assistant perform the personal care in the Spanish unit, while in the UK unit, the nurses were also involved in this procedure. In the pictures, you can see a Spanish room first, in the first one. In the second picture, you can see another room in the UK. Not much differences, but the UK unit, for example, had a special room, a dining room, right, for the patients, while this kind of room did not exist in Spain. The fourth category was health education. Same activities, different professionals involved. Nurses in the UK undertake less health education than those in Spanish units. The principal reason is due to a higher number of specialists, right? In the UK unit, we had occupational therapists, physiotherapists, and speech therapists that they take care of health education in the UK, while in Spain, this was performed by the nurses, and they spend less time on health education. And this is the fifth category, documentation task, different value provided. In both countries, different values provide to the act of implementing the documentation. In the Spanish unit, the nurses only make entries on the patient's notes when there is a change on the patient condition. not documenting all the action provided. This is clear, and the main difference was what I've just explained. The last category was attitude and communication skills, professionalism of the staff. Nurses from both units agree that communication is good between staff members. The principal research in the Spanish unit detect a lack of professional attitudes. For example, it was observed interruption of the staff when having conversations about the patient's conditions. Also observing situations in which staff were chatting about personal issues while performing a professional task. These attitudes were accepted and normalized by the staff as shown below. So to conclude, we can say that differences between nursing practices exist despite both countries having similar nursing competencies. Nursing practices within the rehab units in the UK are characterized by safety practices. The UK unit has a positive safety culture, recognizes that mistakes happen and applies solutions to avoid them. Thank you for your attention.